So good afternoon, everyone. Welcome to our ECHO session, Unlocking Dignity. Sorry, just my screen moved here on me. How to improve the reintegration experience of justice-involved people with life-limiting illness into community. My name is Stephanie Sturl, and I'm the ECHO Program Coordinator at the BC Centre for Palliative Care. Our program manager, Tina, is here today as well, and she's running the Zoom for us and is available for some technical support if you need it. So feel free to send her a private message. I know just looking at the names here, I see a number of familiar names, but I do want to give a little bit of background as to what this ECHO thing is all about. So ECHO is a framework for education that aims to create a knowledge sharing network. We hope to achieve this knowledge sharing through discussion and opportunities for you as a participant to share your knowledge. We value the experience and knowledge that both participants and our topic presenters bring. So we hope to provide a space for you to share, acknowledging that we are all learners here. These sessions are recorded, as you've heard, and the recording will be posted on our YouTube channel. While we strive to create a safe environment in all of our ECHO sessions, we recognize that you might not feel comfortable sharing your name or showing your video. So I just invite you, if you'd prefer to rename yourself, or you're welcome to turn off your camera. Our presenters will start off by sharing some wonderful information with us, kind of set the stage for some discussion, and we really hope to create a space to brainstorm as a group, to hear from you, hear from your experiences. So if you're able to have your camera on for that time, that would be great. As we open this session, I would like to acknowledge that the BC Centre for Palliative Care works with partners across the land colonially known as British Columbia. The work we do occurs on the territories of many distinct First Nations. We are grateful to all the First Nations who have cared for and nurtured the lands and waters around us for all time. We recognize that all of you joining us today may be participating from traditional territories of other Indigenous peoples. From coast to coast to coast, we acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people that call this land home. Our team all works remotely, so I would like to acknowledge that the land on which I work, meet, and live is the unceded traditional territories of the Coast Salish people, including the territories of the Stolo, Semiahmoo, Kwantlen, Tsawwassen, and Katzie nations. Next slide, please. Our ECHO sessions are in part funded by Pallium Canada and their Palliative Care ECHO project. Next slide, please. Pallium's Palliative Care ECHO project is supported by a financial contribution from Health Canada. So as a disclaimer, the views expressed herein do not necessarily represent the views of Health Canada. Next slide, please. Now the exciting part. I feel very honored to introduce our speakers today. Mariana Fisher is a PhD candidate at the School of Nursing at the University of Victoria and a palliative care clinical nurse specialist with First Nations Health Authority. In her clinical nursing practice, Mariana has observed inequities in the way palliative care is accessed and delivered to vulnerable populations, especially individuals who experience incarceration. Mariana's personal and professional goals include advocating for the healthcare rights of justice-involved people, advancing equitable palliative care, and examining social injustices within carceral spaces. Drawing on her unique skill set developed across 2 undergraduate degrees in psychology and nursing, and a Master's of Science in Nursing, Mariana aspires to reduce the disparities experienced by people who face a double burden of incarceration and life-limiting illness. Joining us today, we also have Iridian Grenada. Iridian is a certified trauma-informed life coach, writer, educator, and advisor with more than 30 years experience as an incarcerated person in the federal correction system in Canada. A global advocate for justice and resilience, he works with organizations such as the International Correction and Prison Association, Grow, Transform, Belong, Canadian Criminal Justice Association, 7-Step Canada, and the John Howard Society of Canada. He also collaborates with McMaster's University Department of Family Medicine, using his expertise to inspire progress in correctional and reintegration systems internationally. So I'd like to hand things off to Mariana and Iridian. Thank you so much.
Thank you for warm introductions and welcoming. These are just general learning objectives that we hope the participants will walk out with. But I just want to highlight that we are here as co-learners, and in no way that we are experts into everything we'll be talking about. Some things I've dwelled deeper into my research as part of my dissertation work and proposal writing. And Iridian, of course, bringing vast expertise in lived experience of reintegration. And we just really noticed that there's a gap in the supports for people who are exiting correctional system and coming into community in general, and those who experience life-limiting illness, especially their needs are unmet. And we're just hoping to open the space to really brainstorm and have discussions. How can we move the needle forward in this work and begin at least understanding and awareness about some of the work that needs to be done in Canada in general and in BC in particular. So this is what I learned through my deeper dive and question myself, why is this important? And I think going back to a Canadian legal framework has always been helpful for me to realize that Canada is a signatory on Nelson Mandela rules. And it is written in our law that incarceration in itself is the only punishment that people experience, the loss of liberty, when they commit a crime. And otherwise, they are entitled to the same, for example, around healthcare, the same healthcare standards as people in the general population. And so when there is a gap and inequities in that space, we understand that from legal perspective, we have to move forward to advance equity for people who are incarcerated. And also, as we know, sometimes, and unfortunately in Canada, we also experience this, social, economic, and political forces shape societies in a way that people who are most vulnerable are over-incarcerated. In our, of course, colonial Canadian context, people who are Indigenous and Black people are overrepresented in carceral spaces. I also want to point out, and I wrote this, I've been reading recently um, uh, political economics books, and some of them called necropolitics. Try to understand that some groups in our societies are funneled disproportionately into the criminal justice system. And those are people who are impacted by structural inequities, criminalized by systemic injustices, and the communities that are denied equitable access to resources are most targeted by the criminal justice policies and systems of oppression and control. And this was really important realization for me as somebody working in these spaces to realize that perhaps in my early writing, I was underlining that people who are experience homelessness, poor, and people from experiences of substance use and trauma are the one that entering these spaces. But this was putting an onus on the individual behavior of people and ignoring the systemic forces that in fact target the people who are marginalized. And so for me, it was important to paraphrase and for my own understanding and highlight that societal structures actually favor ableism, wealth, privilege, and perpetuate these conditions, which then disproportionately over-incarcerate people who are vulnerable. With this comes, of course, that higher rates of chronic and life-limiting illness among this population is due to the experiences prior to incarceration, lack of access to primary care. Some of it, for example, for Indigenous population, is especially due to trauma and institutionalization and continuous racism when they enter institutions such as hospitals. Barriers to timely diagnosis and treatment for people who live in rural and remote communities, and of course, the impact of incarceration on health outcomes. There's something to be said about caging human beings and expecting them to do well afterward. And in my work, I think, especially as a palliative care nurse, thinking about end of life care and experiences that my patients have in general population, how dignity and symptom management are important to them and their families, and how some of these basics palliative care rights are not afforded to people who are incarcerated. I also just wanted to, so we have all shared understanding some of the end-of-life care options that are available in correctional settings in Canada. And this is again talking to the Correctional and Conditional Release Act that guides federal prisons. There are different acts that guide provincial facilities, but some of those options available are similar across the two settings. So, for example, parole by exception is granted to individuals diagnosed with terminal illnesses. However, the assessment for such parole is primarily based on a fulfillment of parole conditions rather than health indicators. And often poor health acts as a barrier for the person to be able to fulfill those conditions and such not able to receive the parole. The second option, temporary absence, allows individuals to have escorted or unescorted visits to receive medical treatments that are unavailable in prisons. However, sometimes the cost and availability of escort and availability of community services prevents fulfilling that option. In addition, from my personal experience as a palliative care nurse, sometimes community settings are unwilling to receive and support to provide care to person who have incarceration history and are currently in prison. And as the last resort, the royal prerogative of mercy is granted in extraordinary cases where hardships and sufferings are disproportional to the committed crimes. This option is least accessible, least granted, and most protracted. I found the study conducted just 5 years ago, examining options, concluded that all three alternatives during end of life are rarely accessible or timely, with temporary absence being most viable option in Canada. I also looked into health of older justice involved people on the conditional release in the community. And the numbers you'll see here, they're a bit outdated. In Canada, it is difficult to get the latest statistics in the data from corrections. In addition, these numbers represent only the tip of the iceberg because these are federally released populations. It does not account for provincial released people who unfortunately often find themselves in the revolving door coming out and due to lack of support coming back to the correctional system. As we know, older considered 50 plus in correctional setting, and that's been well researched in the literature that people who experience incarceration are aging at least 10 plus years over comparison to the same age in general population. And what this particular study found is that individuals who served longer term sentences face significant breakdown of community support, severed family ties, and increased barriers to access to vital resources once they're in a community, such as housing and employment. Women had unique challenges. They often lacked social and financial resources and skills, and further faced criminalization and victimization once released. And then those who serve long sentences and being a woman just really intersected for them in the least favorable ways. These women reported even a lack of access to prescribed medications, access to primary health care, and had a very high likelihood of acute admissions. So all this is to say that solving or begin to design ways how we can improve reintegration for people who leave correctional system will not only be legal, morally, and just thing to do, but it also a very financially responsible, because people who leave correctional systems and do not have access to the primary health care, then they have increased access to acute care admissions, when it's not only, of course, it's highly detrimental to their health, but also places a burden on the healthcare. And particularly in BC, we do have a dearth of community alternatives for people with the life-limiting illnesses who coming out of correctional settings. For example, I don't know many halfway houses that exist that would accept people who coming out with those needs. There are a few in Ontario. So Office of Correctional Investigator from 2019 really highlighted that people that were granted parole were not able to use it successfully because they had no place to go in the community, especially if there's no caregivers and family supports that would provide care. And also those restrictions that I discussed on placed by parole or temporary absences prevent individuals sometimes returning home or their indigenous communities in rural settings because there was no access to supports required. And as one person who's very involved in supporting people with justice criminal system involvement, she told me a story where the person with cancer diagnosis started to experience pain while on parole in the community and received opioid medications while attended BC cancer appointment, and then forgot that he has the next day his parole screening, and returned to prison just a few weeks before his death due to this condition. So some of these forces are really important to understand. For me, for example, as a healthcare provider, that shifted the lens, how I view some of the patients that I have a privilege to support during end-of-life journey. And I'll pass it off to Iridian.
Thank you so much, Mariana. Very informative. Thank you so much for attending, everyone here today. And so I would just like to acknowledge as well that I am appearing to you from the Fraser Valley, and that is the territory of the Halkomelem speaking Stolo people. That Stolo means the people of the water, or the people of the river. And of course, that has something to do with that great big tributary running through the middle of our valley out here. But it is my privilege to be appearing to you from that territory today. And it is the territory in which I work and live and play and learn today. And I'm happy to be here to learn with you. So, as Mariana pointed out, the numbers, there were some things there, maybe got a little bit jargony for those who are not familiar with corrections and the regulatory scheme for conditional release into the community. And that's what we're looking at today, is taking a look at how folks that are at end of life journey can affect a conditional release from an incarceration setting. And in order to continue to have that conversation, I'm going to take you a little bit on the journey of how we got here and how I ended up in the penitentiary for 30 years. And then maybe there'll be some takeaways. And of course, any questions, as I said to our colleagues when we were opening this, my appearance here today is probably something that is relatively new to you, someone with my background. So I'm hosting all questions and any questions. I regularly lecture at universities, and yesterday I was online with a pretty esteemed crew. And but the value of having me here is that I can answer questions for you. So everything's on the table, anything's on the table. Feel free to ask afterwards. A little bit of the history of we'll start. We'll go back to the future here. Yesterday, I was co-moderating a panel for the John Howard Society of Canada. It's John Howard Week in Canada. And that panel was discussing yesterday sentencing reform. And so I was in and amongst Senator Kim Pate and a professor by the name of Anthony Dube, who is regularly quoted and used as an expert witness in court cases before the Supreme Court. And the consensus across the board is that the correctional service in Canada is dysfunctional at best and probably could be declared broken without too much of a shove. How did we get there? It's interesting. We're a Commonwealth nation. And so all of our laws and our principles and our practices come out of merry old England. If you go back to Speaker's Corner in London, there's a little spot on the sidewalk there by Marble Arches called the site with the spot of the Tyburn tree. And what the Tyburn tree was that this was the place of execution in London back in the 16th and 17th centuries. And it was the beginning of the correctional system that eventually migrated to Canada in the fact that they created an implement there with three posts and a triangle, three pieces of wood in between, and they could hang folks 24 at a time. And apparently that was quite a popular thing to do in England. And before maybe calmer or milder senses, or maybe our better angels decided that we would try something different. Canada was a really early adopter to something different. And when I say really early, 1834 was when the shovels went in the ground on the shores of Lake Ontario, and that became the Kingston Penitentiary, which is the model for all the penitentiaries and all of the jails across Canada for the last 194 years. And for those of you that are up on your history on Canada and maybe your mathematics, it's pretty funny. I ask kids at university, I say, when was Canada confederated? Well, most of those young people have never seen a penny, so they don't remember that 1967 was the release of the centennial penny. The penitentiary system in Canada predates Canada by probably 3 decades or more. And so it's a very enshrined and entrenched system. Its spiritual head is the monarch of England, no less. And so trying to move and change practices inside that organization, evolution probably happens quicker than that. Some of the folks that were talking yesterday talked about just the absolute impossibility of even good-willed people and very bright people changing that paradigm. So my focus has in recent years been trying to think about how can we assist people when they come out of that incarceration process. Maybe a little bit about me and how I ended up in the penitentiary service. I came from a mixed race family. My mother's Indigenous and my father is a Caucasian man. And I often tease my parents, I was my father's 20th birthday present. Because if you do the mathematics, I was born exactly 9 months after his 20th birthday. So his 17-year-old girlfriend, while she was still in grade 12, became my mother. And I'm thankful to them that they stayed together. They're married. They're just celebrating their 59th anniversary here next month. But suffice to say that they were young folks without a lot of skill and training in raising children. There was alcohol abuse in the family. There was a lot of family violence, a lot of instrumental violence in the family. And so I grew up in that crucible and started to adopt some conflict resolution models that were not very pro-social. And then I had some attachment style issues that I was playing out a narrative that I didn't even understand in the back of my head until I started to take some correctional programs inside of the federal system and in my 30s, I think it was. But suffice to say, I got myself in a lot of trouble. I was 15 years old when I left home. I was incarcerated at 16. And then it was just one thing after another and ended up in the system, surrounded by people who it's pretty funny when you're in a situation where everyone is wrong, you would be surprised how many people tell you that you're right. And that was what was happening in the incarceration section for me. So our next slide is kind of an on-ramp into what life is like in a place that Dostoevsky called the House of the Dead, back in his famous book in 1864. The little fellow on the left, would you put him in prison for 30 years? Probably not. The fellow on the right is a bit of a time traveler. And that was at a presentation that I made in Singapore At the end of being released, I think I'd been released into the community about not quite 2 years, about 18 months. I'd been released into the community, and I had the tremendous privilege of representing Canada at an international conference where we discussed subjects just like this. How do we change? How do we bring in some of the programs that are in the community that haven't traditionally seen a lot of value in the correctional system? And what I asked people to do was a very simple exercise. I asked them to breathe. I invited them to take a breath in, and then I invited them to take a breath out. And then I asked them to do something they had never done before, ever a day in their life. I asked them to do both of those things at exactly the same time. And of course, even if we were kung fu masters, I don't think we'd be able to breathe in and breathe out at the same time. And so I represented to them that you have to make a choice in breathing, and you have to make a choice in the correctional process in your countries. I said it either has to be punishment or corrections. And in Canada, we have not had a prison system since 1951. That's when we became the Correctional Service of Canada. And yet, public doesn't know that. The public still thinks that we send people to prison. The word prison doesn't even exist in the legislation or the regulations surrounding incarceration in Canada, and it hasn't for the entire time that I've been incarcerated in the federal system since 1991. So we have to, first of all, change the mindset about how we think of prison and how we think of prisoners. And so earlier in her presentation, I'm a bit of a time traveler. I say that because you know what is time travel? You go into a box, you push some buttons. When the door opens, it's a new age. When I went into prison, there was no such a thing as email. Some of you are probably wishing that there still was no such a thing as email. But yeah, it was a big change coming out. So I'm a bit of a time traveler, and which is why I refer to Mariana as Dr. Fisher rather than Candidate Fisher, because I just know that it's just inevitable that one of these days down the road, I'm going to be attending her ceremony for her PhD. However, that said, Candidate Fisher said today something very interesting talking about Nelson Mandela. And maybe there's a good space here for an extra slide now, please. There we go. There's the professor. There's the lived experience professor himself. There's a famous quote by him. It always seems impossible until it's done. So when I think about changing the narrative about prison and prisoners and incarceration and the correctional system in Canada, I was in a room full of people yesterday, politicians, lawyers, experienced professors who seemed very exasperated to the point of, it seemed like they had determined that it was impossible. The next slide is my take on Mr. Mandela's words. And so I have had the privilege of having people put impossible hoops before me for 30 years. And I'd just like to talk about two of those people because they're relevant to this conversation today. One of them is Professor Michael Jackson. Well, Professor Emeritus Michael Jackson. Now he's 81 years old, a long staple of the Pierre Allard Law School at UBC. And another person by the name of B. Rhodes, who was a former correctional officer turned educator. So Professor Jackson came into my life. I was in segregation. I think I'd been drinking brew or something. It was somebody's birthday. And we'd made a bad choice there. And we'd gotten the unwanted attentions of some correctional officers. And we ended up in the segregation unit. A short little Englishman with long hair who sort of looked like Geddy Lee from Rush came up and said, I'm writing a book about justice. Are you interested? I was in segregation with somebody to talk to. It was the beginning of an incredible relationship that has lasted over 25 years now. And what Professor Jackson taught me to do, just naturally, without any push, he taught me to have great respect for the rule of law. So that was something that was referenced earlier, kind of almost a bit in passing in Mariana's portion of the presentation today. The rule of law is what separates us from the jungle. And it is a very, very protective barrier for us. It is the framework for our humanity. It's long established, and it, hopefully will keep us from having a third world war. The rule of law is very important. And my being able to internalize that and grow a deep personal respect for it had great value on a cerebral level and a moral level. But it was the work of B. Rhodes, who was a former correctional officer and who came into Agassiz, into Kent, Maximum Security Penitentiary in 1999, looking for a champion for a concept that she called peer counseling. Now, B's history was that she had been a social worker and she had training in that, and she had worked in the Correctional Service of Canada up until a point where her values just no longer could align with theirs. And so she decided to part company, which was to many, many people's great fortune, because B went downtown in Vancouver and started something called the Rhodes Wellness and Counseling College. And that has benefited hundreds, thousands of people over the last 30 years. But its initial benefit in my life was that after 3 years of running the school, Ms. Rhodes came back to the federal penitentiary looking for some folks that might be interested in taking some very basic, not, 24 months, 2 weeks of training on empathic listening and kind of Rogerian counseling skills, how to be a skilled helper, thinking about Egan's book there from many years ago that probably many of you know well. And so I said, well, if you can get coffee, I can get 10 guys in this chapel. And so that was the beginning of a brand new pilot project for the Correctional Service of Canada. At the end of 2 weeks, she gave us just a little piece of paper that she printed out on her dot matrix printer. And she declared us peer counselors. We were now no longer convicts or prisoners. We were peer counselors. And it was empowering. And there was a bit of a groundswell of support for it. We found a progressive warden that was willing to work with us. He actually took 4 of us that graduated from the course, and he gave us inmate employment. We got the $4.90 a day that everybody got, but we got it for being peer counselors. And so we got to really practice what we had learned with Ms. Rhodes in those classes, and then got to hone our own sorts of skills. But something was happening inside of me personally as I was going through that process. And that is, you can't sit and listen to people's stories. We talked today about trauma being one of the lead indicators for people being justice involved. Working in the sector, probably many of you have heard that phrase, hurt people hurt people. It's the truth. There's a lot of empirical evidence and a lot of studies on the fact that folks that are in prison for perpetrating harm to others in the community have themselves a long history of being victims of harm. So listening to those stories and using the practices of empathy that were given to us in the peer counseling training, something started to happen inside of me that was quite a bit different than what it is that had led me to prison. What led me to being in prison for 30 years is that I decided when I was about 27 that I was going to become a professional bank robber. That was my big genius idea of the moment. And then when I was captured robbing a bank and incarcerated, I decided, why would I stay incarcerated when I'm a bank robber? So I made a plan to escape. And I escaped from the prison and went on a bit of a bank robbing spree across Canada. And as a result of that spree, I got into on the worst day of my life, I got into a very, very bad argument with the man that I was robbing banks with. And at the end of it, he was dead, and I had to live with that. It was the last day of his life and the worst day of my life. But, then you got to pay the mortgage. You have to deal with the consequences. And so here I was, a hardened bank robber, someone who had committed murder of another human being, arguably the most unempathetic and inhumane thing that one human being can do to another. I did that. And yet here I was sitting in a maximum security penitentiary listening to the stories of men who had grown up in very violent families, who had been victims of violence themselves, and who had gone into drugs as a way to be able to deal with their pain and their trauma. And now later on, as I do some research myself, I'm in counseling college right now. I start to learn about PTSD and the symptoms of that. Oh my word, the entire system is rife of it. And I started to change on the inside. I started to feel compassion for the men that I was talking to. I started to feel empathy. I started to go in, rather than just sit in my cell and watch television and play video games, I started to go and check on them and see how they were. That progressed into the institution reaching out to me and the other men that were working as peer counselors to start to visit the hospital wards, because the hospital wards contained men who were not going anywhere quickly other than to the graveyard. They were critically ill. There was no opening for them to be back in the community because some of the regulatory schemes that we talked about here in relation to how a person could get palliative care in the community, they're very, very difficult to obtain. Very difficult. Halfway houses just are not geared up for palliative care. And so it's very difficult to get folks who are at end of life situations back into the community, even to die with dignity with their family. And where I was in maximum security was very difficult, almost to the point of impossibility for families to come in and have that end of life experience with their loved one. So I saw things that demonstrated to me that there was a need. And we did the best we could, because you do the best you can with what you have and the training you have. And we were under-resourced. But I think that there's a valuable lesson there. People think that it's impossible until they just make it possible. I mean, I ended up in prison because the word no was not in my vocabulary. No just meant I had to try harder or to be more devious or to take bigger risks, right? But I think that there's a lesson in there. The Correctional Service of Canada, the Federal Correctional Service, is a very entrenched organization to which no is its default position on everything, because to say yes requires resources and change and paradigm change, and you have to overcome your own kind of cognitive dissonance, your own confirmation biases, and that's hard to do. It's way easier to say no, right? But I think the very best answer to no is why not? Let's try it. Let's try something different. And so what we found was a way to get empathy and to get end of life experiences in the most dignified way possible in prison settings. And we did that using guys who were making $4.90 an hour with training by a volunteer that came from the community. So I think that today there will be some great discussions afterwards to be able to sort of think about how it is we can bring dignity. Professor Jackson has often been quoted as being a prisoner's rights advocate. He's argued successfully a dozen times in front of the Supreme Court of Canada on laws and policies related to incarceration. But he told me many times, I'm not a prisoner rights advocate. I'm a human rights advocate working in prisons. And if we can start to think about palliative care that way, that we are just bringing palliative care to incarcerated people. And if we think outside the box, I think that there's enough experience and knowledge and expertise, even in this panel, in this call, in this room today, to come up with some great ideas. So thank you.
So this was our plan that we will brainstorm, discuss if something that you have been already successful doing in your work, if something that you've been curious how we can do it together and would like to open it to the group to brainstorm, to share some of the experiences that you had, but also now listening to Iridian, who is such a powerful storyteller. If you just want to throw it all out the window, I am very open to you just asking questions because I'm certain that can also lead to learning and discussion. So I think I'll leave it to the group to see what works best, and I'll get Stephanie to help me figure it out.
Thank you both so much. So as Mariana and Iridian invited, just I know there's a lot to you're probably thinking over. So we want to create some space, and it's okay if we have a bit of silence to be able to just take time to really kind of mull on some things. But if you do have something kind of ready to share, just to invite you if you want to put up your virtual hand or you can pop it in the chat. If you're able to turn your camera on, we'd love to be able to see you if possible, but we understand if you're not able to. Yeah, and we just again just want to say it again, is that we hope to create a space for us to be able to share and brainstorm some ideas together. I know we've got an interesting mix of attendees here today, so we'd love to hear from you. I see some comments here in the chat. Thank you so much. Yeah, thank you for sharing your story, Iridian. So powerful.
Mm. Yeah, there's an interesting piece.
I'm curious, Iridian, and I don't know if this will help spark any ideas or thoughts. Knowing that you've worked and done a lot of different engagements internationally, have you seen things in other areas that, from your professional and your lived experience, that you could see maybe being a model that could be reworked or used within our system here in Canada?
Yeah, thank you for that question. What an excellent it's like you're intuitive. So it's a great thing you're a palliative nurse. So most recently I was in Singapore and I'd been thinking for a long time, well, both incarcerated and after incarceration, I'd been thinking about how to get the message out to the Canadian public because really a justice system belongs to a community. And the intersection of our subject today is human beings at an end of life experience, but incarcerated. So they're part of the justice system. And just simple language. There's a lot of NIMBYism. There's a lot of not in my backyard. I don't want that guy ever out. I don't care. He should come out in a body bag. Yeah, so that's happening. So there needs to be a shift in public understanding about what it is that the correctional system is. And so I'd been thinking about this for a while. I've been writing about it for the John Howard Society and speaking about it. And then I landed in a place called Singapore. And maybe the next slide, if we have the availability for that, that would be great, please, Mariana. This was something that I had never seen before last year. It's something called the Yellow Ribbon Project in Singapore, which is often known for, right or wrong, painting people in the streets for smoking and chewing gum and spitting. By the way, I never saw any canings while I was there. What I did see was something very interesting called the Yellow Ribbon Run. And the Yellow Ribbon Run is an initiative. It's an old song, tie a yellow ribbon around the old oak tree. I just dated myself, 1970s, Tony Orlando and Dawn. It was one of the top 50 songs ever played by Billboard's list of top 50 songs ever. It's a story about a man who was coming home from incarceration during the Civil War in the United States. And his letter to his sweetheart was tie a yellow ribbon around the old oak tree if you still want me. Singapore grabbed on that concept and introduced it as a symbol for reintegration for folks coming out of prison. And it wasn't specifically for end of life options, but just folks coming out. And that includes end of life options for folks coming out. So the Yellow Ribbon Run was so inspirational for me because it was community led and it was led by the prime minister of the country. I ran 10 feet. Me, I ran 10 feet a person who'd been incarcerated for 30 years for murder, bank robbery, escape, sort of public enemy number one, ran 10 feet from the Prime Minister of Singapore as he led 11,000 people on a 5 or 10 kilometer run that ended in, wow, ironic. I spent 30 years fighting my way out of prison. I ran into the largest prison, Changi Prison in Singapore. That's it behind me there in the bottom left-hand corner and in the photos. And to be standing with 11,000 people inside of a prison led by the prime minister of the country. And the message we were all wearing on our shirts was, we want you back. We want you back in the community. We want you to be part of society. And I was very moved, powerfully moved. And then I thought to myself, how do I bring this home to Canada? And so I started talking about it at a plenary at a conference, a big ballroom with about 500 people in it. And sitting in the front row was a doctoral candidate from British Columbia named Mariana Fisher. And she put her hand up and said, let's go back to Canada and do this. So Mariana and I and a team of folks here in the Fraser Valley are going to have our very first yellow ribbon run to signal to those coming back into the community that they are wanted in the community. Of course, we have expectations for folks who come out into the community. We want them to be contributors. But I thought to myself when I was in Singapore, could something like this work in Canada? And then I realized I have a 7-year-old granddaughter. Many have children in school. I have a grandson who's 4 years old who runs. Last year, he ran in the Terry Fox run with a t-shirt. He can't even spell Fox. He's 4. And so Canada, running with a t-shirt on is as Canadian as hockey. So I thought maybe this will work. Maybe this will work to change public opinion about people coming out of prison, even in end of life experiences, because that's the bandwidth that has to open up right now. We need resources in the community. We need places where folks who are at end of life experience, while incarcerated, can come to. I've seen some success stories, mostly related to faith-based communities who've maybe kind of taken some of their membership, some of the folks that belong to their faith communities now, they've welcomed them back into a palliative situation. But if we had more of that in the community, and it's going to have to be community led, and I believe with all my heart, it's going to have to start with a change in attitude about people coming into the community from prison.
Thanks
And
so
I will
much,
just
Iridian.
add to what Iridian shared, just wearing my academic hat. It was frustrating for me to learn some of the articles that we have in Canada circulating around that we are condemning prison hospices, right? So that's a predominantly form in the United States that they have in-prison hospices that support people with palliative care needs. UK adopted a different approach. They have very strong partnerships between the prisons and communities, where it's a direct transfer for prisoners who deemed safe in the community, experiencing end of life, requiring palliative care, symptom management, and they are transferred to these communities due to those strong relational partnerships. Well, in Canada, we don't have either, really. We have one hospital in Abbotsford that are under federal that provides palliative support. We have potentially some community partnerships across Canada. I'm not aware of any in BC. I know there might be one in Abbotsford. Very grassroots-led, small number of beds. But there are a lot of philosophical thinking saying, well, it's wrong to die inside the prison because prison hospice is normalizing deaths behind bars. And I agree with that. Also, there's a concern, if somebody who is haven't been deemed safe to release in the community to have those community partnership. Potentially there are cases like that. But what I find is to have those philosophical discussion about what's right or wrong, in Canada, we end up with having no options at all. So I think until we as society worldwide find that ideal spaces and places that people who experience incarceration and life-limiting illness can receive and access care, we need to do something. We need to have something perhaps not very ethical and not very philosophically highly developed, but because we in those um, pure verbal discussions, we don't have any actionable places and spaces to care for the people who are requiring. And I know it's not to say that there are not many small pockets of work that have been done by fantastic individuals inside the corrections and in the communities, and nurses who are from healthcare authorities who are meeting those needs at the best they can. But I think if we as a community overall put our heads together and participate in initiatives like the Yellow Ribbon Run, where just to change the perception around the people who are reintegrating into community, and thinking with those who are requiring palliative care needs, that would always can lead to the advocacy and policy changes where we would borrow from some of those more successful initiatives that have been already established in different countries. And I think that's it, what I wanted to say in my spiel. But I hope that maybe Stephanie can share for those who would be interested to join us and to register for the Yellow Ribbon Run on March 22nd. It's the inaugural run in Canada of this type. And this was my dream a year ago. And I can't believe that after meeting Iridian in Singapore, and just deciding to partner up in all those things, that it's coming to life and fruition, and hopefully it will engage communities in creating those spaces.
Yeah, Mariana, I just put it in the chat. If we just go back to that last slide, the QR code there is your registration for those who wish to participate. This is going to be the first one in Canada, but it sure won't be the last. Mariana and I have some work ahead of us for a bigger run in Victoria in in May, at a big conference at UVic on transforming justice. So yes, you're invited. Please register. Thank you.
Just wanted to highlight a comment from earlier from Willa. Thank you, Willa. I just wanted to say thank you so much for bringing these access inequities to light. I feel across our spectrum of care, we are seeing more barriers and gatekeeping policies and processes put in place, which feels to be the opposite of the Ministry of Health directives to provide client-centered care. I'm sure others on the call would agree with you on that, Willa. Just wanted to invite again, if you have any questions for either Mariana or Iridian, we do have a few minutes, and they're here and they are a wealth of knowledge and experience. So if you, anything you'd like to ask, or any ideas to share. I wonder if for some on the call, if it's even just kind of taking a couple steps back, and maybe you don't have ideas on how we can really be doing this work on a practical sense, but how can we kind of going back to the beginning, as we talked about a number of times throughout the session today, is how can we change some perception and bias, and how can those of you who are on the call maybe be that kind of that lead in your settings, wherever you are and whatever your role looks like, to kind of take that on a little bit, to kind of challenge maybe some notions that colleagues or other patients you see might have about this population and what that looks like in your community. I just see another question here in the chat.
Yes, I just noticed it.
Yeah.
I was going to answer. So, absolutely. I'll tell you a funny story that we learned in Singapore, that Czechoslovakia, they've been participating in this conference. To me, that was first year. They really loved that initiative and they took it to their country, and now they have funding to start running across Europe. So they started with just 30 people on their first run. And then the funniest part, their English was not that great and they misunderstood, and they actually ended up, they thought that people who are incarcerated can run too. And they released their people who are incarcerated with their correctional officers, and they participated in the run too. And then they shared in Singapore, and Singapore said, no, we don't let people who are incarcerated run. And they're like, oops, we We just, I guess, got lost in translation there. So yes, it's we're envisioning it as a grassroots movement led by 7-Step BC people who experience incarceration. So a very, very appropriate and wonderful leadership grassroots movement. And then once we have that, led and established and have here in BC, we would collaborate and partner up and share our experience of how we did it and to make sure that happens anywhere who would like to envision it anywhere else in Canada. Kathleen, your hand is up.
Yeah, hi everybody. I'm really happy to be here. I'm the Director of Strategic Initiatives at the Center for Palliative Care, and just thank you so much, Mariana, being here, and Iridian. And I'm so excited to see that yellow ribbon because I remember Mariana mentioning it to me a while ago. So it's exciting to see it actually happening. I have a question as a nurse. I have a very clear memory. I think I might have even been a nursing student at the time of looking after a gentleman who was handcuffed to his bed in a surgical ward and had a protection or a corrections officer in the room with him. And I had read in his chart something I wished I didn't know was that he was a sexual offender. And what I'm wondering is my experience was that my fear of being in the same room with him got in the way of my compassion. And I don't want it to, but I was afraid for myself and I felt so vulnerable. So how do you address the fear that healthcare providers have sometimes, even though they want to be non-judgmental and compassionate? How do you address that?
Would you like me to take that one, Mariana, or you got
Yeah,
that?
give it a stab. Yeah.
I think, some of the specific training that we got, I talked about my own internal journey, my own internal, I'll just be quite plain about it. There are two categories of prisoners that are definitely at the very bottom of the social strata, and that is known informants and sexual offenders. In the Canadian penitentiary, these folks, they get a very rough ride from the other prisoners. And yet I became a counselor for men that I knew had sexual offenses. So how did that happen? It happened because I got some training, some specific training in empathy, attunement, and encouragement. And I don't know that there is specific training that nurses go through for empathy. I mean, it's just sort of implied that, if you're attracted to this sector, you must be an empathic person by nature. But there's empathy and then there's empathy. And you just described this was one that really drew on your resources of empathy. So I think that if there was some specific training in there and even just a normalization of the fact that, a person is not their event. The event that put them into prison is not them. So, that's what helped me to become a more empathetic person and to be able to assist my fellow prisoners. I don't know if that answers, and I don't know if there's a way to increase the training on that, but I think
Iridian,
empathy is
I'll
the
just
key.
add to this. As somebody who's been a nurse and providing care in acute care setting, we never know which patient might perpetrate an aggression against care providers.
Yeah, true.
We know that, right? So we
Yeah.
experience aggression. I've had a partner nurse thrown across the room by just a very, well-to-do gentleman who just had terminal agitation, right? So I am trying to give the benefit of doubt to any patient that I provide care. That's how I come in. And just to really try to remove that judgment by saying they're a human being, they're in front of me now, and my job as a nurse is to provide care. I tried to leave it at that baseline. And then, of course, for example, you mentioned there was correctional officers, so you have probably that safety piece. And I know even as nurses, somebody can have the purple dot, right? It means the patient had some aggressive behavior. We say, you put your hair up, you don't have lanyards. So we already have those, in terms of safety protections there. And from my little research study that I had last year and what my participants shared too, that when the healthcare team provides care to people who are incarcerated, in any capacity, they've seen nothing but the gratitude. And these been the most, model patients, if you will, because they're so grateful that somebody sees their humanity. So I think when we, don't come with that fear that's palpable in the room and might then, be felt by somebody who experienced trauma, but to employ, and the training that we do have as nurses is trauma-informed approaches. So what we have was our trauma-informed approaches and those typical safety things that we bring in, and use in our everyday work. When we have the combination and just concentrate on humanity of the person that's during end of life journey in front of us, I think that can help to overcome some of those, deeply seated, deeply rooted, maybe stereotypes, maybe, social practices that have been maybe even unconsciously embedded in us, right? To be afraid of people who are incarcerated, to worry because we don't know what they were incarcerated for example. Um, and I think I shared that story might have before, but it's always reminds me of that. What you asked is my son walking during his lunch break from school to buy a slice of pizza, and a person who was visibly unhoused, in a tattered clothes, unpleasant smell, walking close to him and trying to engage him in conversation. And my son was very, guarded, protected, visibly, shoulders drawn, uncomfortable, trying to answer, not to be too rude, but guarding himself and kind of walking a step ahead and trying to show that he's not comfortable with the situation. To then in that, 20-minute walk, having been connected to that person and that person felt comfortable to share, saying, at the beginning, when I just approached you, you seemed very tense and uncomfortable with me. And he said, I'm, and the person shared, I've been incarcerated. I understand how you might feel about my appearance and what I shared. But he said, this is not the person I want to be. And you having that, the way your sort of behavior outward expressed to me made me feel very sad because it reminded me the person that I was. And so he said, next time you see a guy like me, just try to, see the person I want to be now. And next day, my son called me and said, Mom, there's a house person need to buy the pizza. Can I buy them a slice? And I said, go for it, right? So there was like immediate change of how my teen felt about all this. So I think that's the change we can all begin to foster in ourselves to see the person maybe that person wants to be now.
Thank you.
Thanks so much, Mariana. What a wonderful example to take from. Thank you for sharing that. We are a few minutes after 1, so I do appreciate it. And I wish we could stay on. If anyone does have a final question, feel free to stay on, but I do understand and value that. I'm sure you have other meetings and work to get to. So thank you for joining us. Thank you so much, Iridian and Mariana, for sharing your experiences and your stories. And there's more we could talk about. So maybe we can do another one. That would be lovely. Thank you so much, everyone. And there will be a survey that will pop up as you leave the session today. And we would love your feedback on it. Thank you so much.